Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert. Today I am here with my very colorful and coiffed co-host, Dr. Millicent Ravello. How are you?
I am doing very well. How are you?
I'm great. You got the whole look pulled together.
Yeah, I'm doing this like princess thing today.
Yeah, and then you got the blue
Got the
shoes to go with it.
yeah.
I mean, very, very awesome. Looks great.
Thanks.
And I am also here with our well put together patient who has
Yes.
decided to join us, Michaela.
Hi, guys.
Hi, welcome.
Thank you for having me.
Yeah,
course.
thanks for joining us. We're very excited to talk to you about your rhinoplasty journey, and I think our audience is always excited to hear about what it's like to go through the experience of having a rhinoplasty, of having plastic surgery in general. So we want to kind of run through it, if that's cool with you.
Yeah, absolutely.
This just in.
I'm like, oh no, we're going back in time.
Well, so here's your old nose, and no, we'll talk about this in a little bit, but we'll look at those in a second. What was it, just from a standpoint, like, when did you wake up and say, I think I need to go get a nose job?
I think it was when I started actually looking at pictures, and the first thing I noticed was my nose, and I felt like you couldn't see my hazel eyes or my smile. And it's just like my nose was just the most prominent thing in photos. And I just didn't like that about it. Yeah.
Do you remember this?
Yeah, I do.
We're showing Michaela, and here's Dr. Ravello, you can see
Yeah, I
the
can see
pre-op photos.
Yeah.
So what was it? You just thought it was too big, too wide, too this, that, the
Yeah,
other?
I thought it was too big, too wide. I didn't like the tip, how it went downward. And then I did have a little hump, I believe, on the top slightly. Yes.
Yep, little hump there
Yeah.
too. We'll show that. Let's see, we can put that up for our viewers on the. Wait, that's the after. There you go. So this is the before. I think I'll put that one there. See if you can see that there. And you can see her now. So we've obviously made some rearrangements. But so those were kind of the things. It was too wide, dominating your face.
Yeah.
What age were you when that first came to mind? Were you 10,
gosh.
14, 16?
I want to say I was about 18, really. I felt like when I was in middle school or early high school, it was just like, oh, my face is changing. I'm changing.
Right, everything's awkward at that age.
Correct. Yeah. And so I feel like when I was actually in college, I'm like, okay, well, I should be pretty developed right now. And things weren't changing anymore. So I was like, okay, well, I need to do something about it. And that's kind of when I decided to think of rhinoplasty as an option.
And so did you then, at that point, you're like, okay, I think I need to get a nose job. How did you go about, what's the process that led you to, find your surgeon, which was me, but was it a lot of reading? Was it a lot of asking people? Was it referral?
So my dad has always been in this space, and so I kind of grew up around this type of stuff. And so I always kind of knew it was an option, but I never thought I would actually do it. And so I kind of went to him first and was like, hey, I really want to get rhinoplasty done. He's like, you're crazy, but okay. And I was like, do you know of anyone? And he was like, yeah, let me give you a couple of names. He goes, you look at them, you do your homework. And
Right.
I said, perfect. So I looked at a couple of surgeons. I honestly went straight to their website and looked at their pictures, like before and after pictures. And I'm like, I don't like how these noses look. And they all kind of looked the same, depending on the surgeon. And so then I came across your website and I looked at your work and how aesthetically pleasing the noses were. And I was like, okay, I like that nose. I like that nose. I would be fine with that nose. And then that's when I decided to follow through and make an appointment with you and kind of go through the process.
I mean, we talk about that a lot.
Yeah,
about
you got to look at the befores and afters.
Right.
You got to like their work because that's what you're going to get. And it's gonna
Exactly.
be the same, not the same nose, but you're going to get a version of a nose that they do.
Right.
Right.
And there are style points too. Like if you look at Dr. Ravello's like breasts on her, not her breasts, the breasts on her website.
You can look at my breasts. I'm cool with that.
But you know what I mean. You can see that there's a style to them. There's a style to the way that, I do facelifts, the way that I do noses. So that there's a feel that you have to look at, and it has to agree with your aesthetic eye. It's really important. And I don't think people spend enough time with that, because they are, we were joking about me bringing in the TikTok of the week, but they really are kind of going by things that are not relevant in terms of results. If a surgeon is a good dancer, I'm not sure that equates to excellent results in rhinoplasty.
Did you do social media research as well, or were you mainly just going to websites?
I first started on websites, and then I would look at their social media, kind of see the following ratio,
like who they were,
and stuff like that. So yeah, I did use social media help too. Yeah,
I think that's pretty standard. I think that's actually an old-fashioned way of doing it. I feel like a lot of people go the other way around. They find their surgeon on social media and then they go to their webpage. Certainly either one is fine, but I think that is a kind of older fashioned way of doing it. I feel like the website and then the social media. But I think also it just depends. Everyone's different in terms of their comfort level and where they want to go first.
Yeah, I just tapped on gallery and I was like looking at the photos, and I feel like with social media sometimes you have like range of different things going on. So I was like, okay, that's like too much searching. I'm like, I just need before and after straight to the point.
I agree. Yeah, like it's all right there for you. Categorized, organized. On social media, you'll be like, oh, that's a cute kid. That's a cute kid. All right, it's vacation.
Yeah, or I was like, oh, there's boobs. Like, I don't need that right now. I'm like trying to find a nose.
Right. Yeah, totally.
Yeah, and that is, I think that's why it's good from our standpoint as plastic surgeons. You got to have easy access to your gallery.
Agreed.
I mean, because it is, if you look at the stats on my website of what people do, they do two things. They go to the gallery, and then they look for the contact form. That's it. They don't read the fact that I have a blog. Like the blog does not get a lot of action. My credentials, all that stuff, they don't even click on it. It's really amazing.
That's so bizarre to me.
I would be like reading, like, where'd this kid go to high school? Know, like, where you want to know all that, but it's not the focus. The focus is before and afters. How do I call the office? And that's it. And a lot of that's available on Instagram, TikTok, and on my LinkedIn people actually use too, which is, I think, interesting. But so you did that. You did your research. You looked at the gallery, and then came in for a consultation.
Right. So I came in. I was kind of blown away because you immediately take out a paper and hand draw my nose in like under 30 seconds. I'm like, who is this guy? And so I was like, okay. I get out of the consultation. I'm like, I want him as my plastic surgeon. And I just felt like I could trust you and you knew what you were doing. And I listened to one of your podcasts. I don't remember what year it was, but you said you did over 4,000 rhinoplasty surgeries. And I'm like, okay, this is the guy. Like, he's probably seen it all. Like, if something goes wrong, he's probably already seen it. So
true. Yeah, I mean, you want somebody who's done a lot.
Right. So that's kind of how I knew. And I was like, if it's not him, it's not anyone touching my nose, because I felt like if I went to someone else and they screwed up my nose, I'm like, I don't want to have to do a revision. Like, that's not something I want to go through. I'd rather just keep my nose the way it is, even though it's so big and prominent. Like, I'm like, I'll just deal with it.
Well, it wasn't that big. I mean, come on, Michaela.
So did you go to other consults as well, or you came in one and done?
I kind of one and done. And my dad's like, okay, well, I trust him, so let's make it happen. And I'm like, agreed.
Perfect.
Yeah, it's really different. Like, you look so different with this nose compared to this.
Yeah.
Right.
I mean, it's pretty striking. So we did go over all the things that you wanted. I mean, you had like a wish list of for your nose.
I did have a wish list. I think I had 3 or 4 things, and I honestly thought it was kind of too much. I'm like, oh my gosh, this guy's gonna only want to deal with one thing.
Like, just one at a time.
Just one at a time. I'm like, oh my gosh, he's probably gonna think 3 I'm crazy, but no, you're like, oh yeah, that's doable. That's doable. I'm like, really? Okay.
So what did you want to have done? What was your wish list?
Wish list.
If you remember.
No, I do. It was to make my nose, like the nasal bone, is that what it's called? Smaller.
The bridge.
The bridge, smaller.
Okay.
I did have a little hump. I wanted that to be taken out, and I wanted more of a slope look from the side. Yeah. And then my tip in pictures, it would go down, and it was almost like too far out that my lips looked super tiny. So that was like another thing.
You can see it there on the profile there. She did have,
like, it went out. Yeah,
and I thought that her tip was under projected. As a matter of fact, it was sort of a little too close to the face, And then I also thought that the alar base was wide too. I think we wound up narrowing these, right? Didn't we do that?
Yeah.
So we did. So those were the highlights were narrow the bridge, take down the hump, elevate, rotate, and project the tip. I guess that's a lot. And then also do the alar base excision. So it was a fair amount. And, it was not it's not a chip shot rhinoplasty by the long shot. I guess in a way it would have been good if you'd had some other consultations to kind of hear the other ideas, because if you go to 100 plastic surgeons, you're going to get 100 different approaches to your rhinoplasty.
Yeah, and that's what I didn't want, because I was like, I honestly didn't want to think too deep about it, because I was like, oh my God, I'm going to get so nervous and then I won't want to do this. So I was like, I just need to full force, get it done, make an appointment, let's pay for it, let's get it done with, let me
Just
recover, let's do it.
That makes sense. I get that.
Yeah.
Like, don't confuse the space.
Yeah.
Just, you have your mind set on it and just do
Right.
it.
Go do it.
Yeah.
Yeah, and then you went through the operation. What was that like? Was it as expected? Was it more painful? Was it harder? What kind of came up for you in terms of going through the operation?
Yeah, so post-op, is that kind of post-op?
Yeah, I mean, you came in the day of surgery.
I came in the day of surgery,
You
super
did great.
nervous.
Yeah, you did really well. No sweat. You met with Roberts and all that, right?
Yeah.
Our anesthesiologist.
Yeah, he was great. He actually made me feel so comfortable, because so weird, but my biggest fear was actually waking up during surgery. That was my biggest
very
fear.
common
I didn't even
fear.
care how my nose looked. I was like, I didn't care how I looked or how I felt. I was like, as long as I don't wake up during surgery, I'm going to be okay. And so when I did wake up, I was like out of surgery. I was like, oh my gosh, I made it through. So
interestingly, I cannot recall, knock wood, I haven't had anybody talk about recall from our anesthesia at this center.
I've never had a patient have recall. That's
not
so rare.
Yeah, it doesn't come up, and people are concerned about it, because I'm sure they've seen these
there's a movie.
These movies about it, that's like I'm awake during surgery.
Yeah.
But interestingly, say that were to happen, we use so much local anesthesia to control the bleeding of the operation that also the area is numb, so pain would never really be a part of that, even should it happen. But I've never heard a patient come back and say, I have some recall from the surgery. I heard you saying this or that or the other thing, or, you guys can't sing, Led Zeppelin or whatever, whatever you do during surgery. And we chit chat and all that, but that's just not a thing, which is good.
I was out.
Yeah,
I
that's
don't
good.
remember anything.
And then you wake up and it's done, which is the best thing.
So, and afterwards, was it as painful as you thought it was? Was it less painful? Was it kind of like what you expected?
Honestly, it was kind of just what I expected. I remember I felt so much anxiety, and I think I was bleeding a lot, as I was told. And so my parents were like continually having to change the swabs under my nose.
Yeah, you did ooze a lot. That's right.
Yes, I did.
I remember that.
And then you were like, use the anxiety pills. So I popped one of those, and then the bleeding pretty much calmed down. So
there's a reason we prescribe those.
Yeah, those are not suggested.
Yeah, it's like
take these.
Take them. Yeah, that wasn't a suggestion. Those are actually orders.
Yeah, so then I was
really
like popping those like hourly.
And it is interesting that when your blood pressure comes down and your level of stress comes down, that the bleeding slows down.
Totally.
I just fixed one of my friend's ears today. Her third piercing ripped through her ear somehow, and so I put it back together, and she just texted me. She's like, "Oh my God, this is bleeding like crazy." I was like, "Oh, are you taking it easy, or are you just running around like a nut?" She's like, "I have 4 kids. What do you think?" I was like, "Well, when your day's done, it'll stop oozing." That's kind of how it goes.
Right. You kind of just gotta chill.
Like it goes. You're busy, and then it's gonna drain. You calm down, it stops.
Yeah.
That's good. And then you had everything in for a week, or a
Right.
little longer. Did we have to keep your Doyle splints? So how were the Doyle splints? The ones in the nose.
Okay, yeah.
Were they miserable, or did
No,
they
I actually
work
wanted
okay?
to talk about that, because
Good.
I do have some friends who had rhinoplasty, and their surgeons used packing. So that was
that's
another reason why I really wanted to go to you, because they were saying how awful that week was. They only could breathe out of their mouth. They could hardly eat. It was just terrible. And I was like, okay. I don't want that to be me. I love breathing. So when I was able to actually breathe, I was like, okay, this is nice. So
Yeah.
it was still painful. It was still discomforting, but at least I was able to breathe normally and not strictly out of my mouth for a week.
Yeah, those Doyle splints, they are internal splints that go in the nose, but they have a hole in them so that you can actually breathe through the nose. Sometimes they do get clogged up and you can't breathe as well through it. But the idea is that when those little holes are open, you can actually pass air through the nose, because when you can't breathe through your nose, that's miserable. And that definitely contributes to a feeling of anxiety. So yeah, we like those Doyle splints.
Right. Yeah. Agreed.
Well, and the packing is just
And then
medieval.
the packing coming out is no good either. How was the splints coming out aren't fun either.
Yeah, not exactly. I honestly thought it was going to be more painful than it really was. I was expecting the worst for those coming out. I was like, oh my gosh. But no, it was just one.
Yeah.
One. I thought it was going to be like multiple things, but nope, it was just
There's
one. I was like, okay, one
easy
on
each side.
Yep.
And then you have the splint on the outside,
Right.
which comes off relatively easy.
Easy, yep.
And then that's sort of the worst of it. Once you're past that, I mean, you can tell us after you're past that first week in terms of pain and recovery.
Yeah, it was pretty much easy going from there. Yeah. And then I would just tape my nose. I actually like to tape it during the day. I know you just said you can just do it at night, but I like to do it during the day. I don't know. I just felt
I
like
agree.
it was just more secure. I don't know.
Yeah.
It's like having a cast on.
Right.
Yeah.
Right. Like
Yeah,
if a
so
little bit's good, then more's better, right?
Yeah.
Yeah.
Yeah, the taping is a big deal, and there's some surgeons that don't tell their patients to tape at all. I mean, there are, when I made my first nose taping video, it was the only one on the internet on how to tape the nose. Now everybody who likes to tape the nose, the surgeons who like taping as part of their post-op, they all have their own videos. I've kind of watched them, and there's a lot of different techniques. There's a lot of different ways to do the taping, and for me, it's all about trying to control swelling. I think it makes a difference.
I think it makes a difference. I mean, we put our post-op liposuction patients in compression garments to help with swelling. Why wouldn't compression on the nose do the same thing?
Yeah, I think
No,
it
I
helps.
agree.
Did you notice a difference when you taped versus not taping?
Oh, absolutely. Yeah. I think I went one night actually without taping, and I woke up and I was like, oh my God, my nose just feels big. My face feels big. Everything feels huge.
Yeah.
Well, that's good. And then I know with your post-op course, we had some moments where like things were not really progressing the way we wanted it to. I mean, we hit some walls. So tell us about that.
Yeah. So I was at dinner with my family, and my dad goes, why is there a bump? It was like, I don't know what you call this, but there was like a bump on my nose, and it was like, it felt like a bone. And I'm like, what are you talking about? And so I looked in the mirror, and I'm like looking at like my angles, and I'm like, oh my gosh, I see it. And so I go, well, I'm going into Dr. Calvert's office in like 2 weeks. It doesn't affect my breathing or anything, so I'll just wait till then to talk to him about it. And he was like, oh, I have some tips and tricks, don't worry. So I felt good. I was like, okay. And so he put some filler in there, and then it smoothed out, and I've loved it ever since.
Yeah, it's been no worse for the wear.
That was how far out from
Oh
your
gosh, maybe 4 months.
Yeah.
4 months.
4 months out?
something. Yeah.
Okay.
And so like with the post-op healing of some rhinoplasties, and just depends on how much, we made your nose significantly smaller. So there's a lot of
Right.
skin flopping around that has to shrink wrap around the new
Right.
framework.
And that takes time.
And the swelling can be a little unruly. And so interestingly, you developed a little bit of a bump, but it was really that there was a deficit of swelling in one area. And so like I treated the swelling with a little bit of dilute filler, and that seems to kind of work. There's a couple of ways to deal with it. And I mention this because, if you watch social media and you watch these videos about the post-op course of rhinoplasty, everything seems like it's rainbows and unicorns and flowers are thrown. And that's not reality. The reality is you got to
not at
heal
all.
this,
Right.
right? You had to go through it.
Yeah.
Like, and there were moments that you were like, "Ooh, did I make the right choice?" I mean, did that ever come up where you're like, maybe I shouldn't have done this?
No. I mean, I did not listen to you in regards to don't take pictures in like 3 months. So I was taking pictures, posting them on social media, and I was looking back and I'm like, oh my gosh, my nose was huge. Why did I think it was okay to post that? I mean, it was smaller
There's a
than my
reason I say
original nose, but I'm like, I look so swollen. Like, what was I thinking?
And people do it, and that's okay because then it is fine. I mean, I put up photos of immediate post-ops and things. It's because I want people to get the big picture. There's this grandiose, glorified kind of presentation on the internet and on social media of what the after is about, and I think it's better that people know what they're signing up for. It's more down to earth and transparent that you got to go through it. Like this is real,
Right. It's going to take some time to get that final result. And so how did you, in terms of your recovery, how did you plan time off from school or from work and you're going back out in public? When did you feel like you were ready to go back to regular life?
Right. So I did actually plan my surgery around Christmas break.
Okay.
So I was like, it's either Christmas break or it's summer break. We got two options. So I decided to do it around Christmas break once again. So I wasn't really thinking about it that long. It's just, I wanted to go right into it.
Yeah.
And then I guess, I don't know, living in Malibu, I was just like, whatever, everyone gets plastic surgery, let's flaunt it.
The nose splint is an accessory.
Yeah.
We should have monogram designer nose splints.
Right?
So true. Yeah, I mean, it's it is true. It's Southern California. Plan accordingly. This is that we do this stuff here. My facelift patient was literally walking around Rodeo Drive today, whatever.
It's the look.
Had a facelift, and oh my God, who did it? I know Jay Calvert, his work, and blah blah blah. Yeah, so it's good. It's fine if you can just kind of own it and go with it.
Exactly, and that's kind of what I did. And then going back to school, we still had to wear masks, so I just kind of put the mask a little over and just.
Off you go.
Yeah.
Off I went. Yeah, I just taped my nose, put the mask over. I'm like, do not pull the mask down.
So what has it meant for you in terms of you had all those reasons that you signed up to, I need a rhinoplasty. It's too wide. It's taken away from my look. What have been the benefits? In looking back, from where you were before this operation to now, what are the benefits that you really think you got out of having rhinoplasty?
I just think for myself, just feeling more confident. I have some friends who actually noticed right away. They're like, you look different. Is it your hair? Is it? I'm like, no. And I told them. Other people were like, I had no idea. What are you talking about? What?
Yeah. You should have been like, yeah, it's my hair. It's a different color. Didn't you notice?
Right.
And I would have been like, oh, okay.
Exactly. So some friends did notice, others did not. But I just felt better for myself. I was like, okay, yeah, look at my side view.
Yeah.
I mean, you're doing this whole podcast in profile.
Yeah, I know.
Right? Yeah. How about that?
I mean, that's not a bad thing.
And so I guess, it sounds like you're happy with your nose.
I am very.
At what stage or how far after your surgery were you finally like, yes, I love my nose?
Oh gosh, I would probably say month 6.
Yeah.
Month 6.
It's a decent amount of time.
Yeah, I mean, honestly, I never hated it or never disliked it, nothing like that. But I would go back kind of every so weeks and be like, wow, it looks different. It looks different. It looks different. But it's getting better every month. And I still think there's room for it to even get better than this. I don't know how, but I still feel like it's possible.
It's how far out now? Or
oh gosh, it's October. I got rhinoplasty in December. So
yeah, so you're coming up on a year.
Yeah.
But not
I
quite
love
a year.
it.
Yeah. So I mean, and it will change up to really 18 months. I mean, that's for sure. The we say, oh, it's pretty well healed at a year, but it does continue to change. It settles more. I think as much as you like it now, you're going to like it more at 2 years, and you'll like it more at 3 years.
Right.
I think the nose becomes more natural. All that residual swelling and the scar tissue that's forming organizes, reorganizes, and becomes soft. And you wind up with a nose that, you kind of own it at that point, which is not a bad thing.
No, not at all.
So confidence was the big thing. What about in terms of photographs or, professional interactions, anything where you say where you notice that you just feel like this was the right thing for you? Any of those things come up?
Yeah, taking pictures with friends and stuff. They're editing their face and stuff. I'm like, I don't need to do that. I'm like, I look fine. You can post it.
Well, you
I
can
show
give
up
them
edited.
That's right. Send them in. We will edit their faces on a permanent basis.
That's so funny.
No, it's true. I mean, I think it's great. I mean, I see it over and over again. We do a ton of rhinoplasty and just even a lot, just all the stuff that we do that builds confidence for people. It's
oh my gosh, it's so true. When
it's
they
very
come in
powerful.
with it's noses, it's breast, it's for me, it's liposuction and tummies. I hear it over and over again. Like, I have never felt so comfortable in my body, so confident. The things I can wear, the way I interact with the world is just game changing.
Right.
Yeah.
It's good. It's a good thing. What would you tell to the person out there that's listening, that's thinking about rhinoplasty? What would you give them in terms of your sort of having been there, done that advice?
Yeah. I would just say, like, if you want to do it, do it. Really, especially with like Dr. Calvert, like he's going to be checking in with you over and over. So it's not like, oh, like post-op, like never will see you again. See you in 6 months. Have
good
fun.
luck with that.
Yeah, good luck with that. No, like
There are practices that are like that, though. There really are.
I figured.
I mean, we talked about my
talked about
one
that just
friend who's like,
recently, yeah.
go. He sends his patient home, take your splint off, good luck, and
Yeah.
and never even bothers to see them back.
Yeah, and I felt very comfortable because you're like, oh, I'll see you in 2 weeks, or oh, I'll see you in a month. Okay, 2 months, but if you have any problems, text me, call me, like I'll get you in. And so I felt very comfortable. Like if something were to go wrong, or if I didn't like something, I could easily call you and you would find a solution, you know? So I think
that's very
helped.
helpful. That
Yeah.
level, it just brings down your level of anxiety and
Right.
helps your comfort level. If you know that like my surgeon's right there if anything goes wrong, and he's not just throwing me out and forgetting about me.
Exactly.
Yeah, 1,000% agree with that.
Yeah, no, it's really important. I mean, that's a big deal.
Well, even just, I mean, obviously it's the level of comfort and the anxiety, but also like we catch things if you come back and see us frequently that may go, missed, if you're not coming back as often. So that's for my own anxiety reasons. I like my patients to come back and see me frequently. So if there are problems, we can catch them.
Yeah, no, and I appreciate that because maybe you see something that I
Right.
don't, like up my nose. I don't look up my nose on a daily basis. So yeah, that eased a lot of my anxiety. So
Good.
Yeah, I mean that's about it. I mean, you really want to have a place that you feel comfortable. That's a big
Right.
part of it. You want to go to a place where, and people listen to this podcast all around the world, so not everybody's going to fly to Beverly Hills to have their nose done.
Right.
But you want to find the surgeon that works for you. You want to find the practice that agrees with your system, because things do come up as you saw. They do.
yeah, exactly. And that was a fear I had going into it, but I knew that you would constantly check in on me, or I could easily get a hold of you, and that's why I was like, okay,
That's
let's do
helpful.
it.
Yeah, you gotta like the results, and you gotta feel comfortable
Right.
with your surgeon. You may have a surgeon that has great results, but if you don't feel comfortable with them, or you get a strange vibe from them, it's not helpful. Not
No,
helpful
I
at
mean
all.
you really want to feel like this is this group of people, because it is my whole practice. It's my coordinator, it's my PAs, my nurses, the whole all of my assistants. You need those folks to be on your team.
You need people.
You need people.
You gotta have people.
Yeah, my people are gonna help.
My people. Yeah.
Yeah, because I'm in the OR. Although I'm trying to be in there. Less to I've got a lot going on with my family, with my kids. They're all going to college now, and it's like it's crazy. Yeah, I mean, one's in boarding school, and it's nuts. So you also have to be like a human being, and it's good to have a surgeon who is a human being. That makes a big
Right.
difference.
Yes.
Because they get it. But yeah, I love doing rhinoplasty, obviously, and I always say, like, I've never gone to work a day in my life because of what I get to do. But in terms of your patient experience, yeah, I mean, look for the things that you talked about. I think those are really, really great advice for people.
Yeah, definitely. Because I even feel like some of my friends want rhinoplasty done. They ask me about my experience, and I'm like, well, what's stopping you? They're like, oh, fear. I'm like scared to get it done. And I'm like, are you scared of the result? Are you scared of like where to go type of thing? And they're like, well, I'm just scared that he's going to do the surgery and then I'm off on the streets and like we'll have to wait 6 months to try getting in again. And I'm like, no, that's not the case usually. And so I
Depends
refer
where
you.
go. Well, nice. Yeah, no, I think that's where my patients come from in the first place anyway, is it's all referral
Word of
issue.
mouth, for sure.
Well, great. Well, Michaela, thank you so much for sharing your experience. We really appreciate it.
Yes, very much. Thank you.
It's
Thank you so
awesome.
much for having me. It's been an honor.
Yeah, we could probably should do a little tour of your nose before we go.
Probably.
Maybe kind of scooch over this way a little bit. I'm gonna slide Millicent over for a second, then let's see. So just some of the highlights.
we're doing it. We're doing it
right
now. Oh, okay.
This is happening. Like, look into the camera.
Happening live.
Yeah, right. So you're
So
just
am I tilting up?
no, just look straight at me. So like if you look from the side, you know, our viewers can see from there, but you do have a slight hint of a curve. You don't have a scoopy nose, you know, and that was something that we talked about, because I don't like scooped noses, but I do like a nice feminine curve like you have. Your dorsal aesthetic lines, if you look at that camera right there, yeah, that's good. Then the dorsal aesthetic lines are really nice. They come down and they show the definition on the bridge of the nose. Your tip is very well organized. We've narrowed the base significantly. I think I took about 2 millimeters out of each side. You know, it was a pretty good ailer base. And if you look up at the ceiling, I'm not sure if they can see that, but the cuts for the ailer bases are really well hidden. So
yeah, I can't even.
Yeah, they're not up on the sides.
I wouldn't have even known that you had them.
So some people cut up on the side of the nostril.
Oh gosh.
Yes.
I was using sunscreen too. I was like, under my nose.
Very important.
Yeah.
Yeah, because you had an open rhinoplasty.
I did, yeah.
So it was open. We cut here, flipped it open, and did all this work there. So it looks great. I think
it feels great.
We'll put your before and afters up on the website and all that. But it's a, you know, that's kind of what you should expect if you go into rhinoplasty. So, well, thank you very much again.
Yeah, thank you again.
And Dr. Ravello, anything else? Any other comments?
No, just thanks for coming.
Yeah, thank you for having me.
Of course.
Well, then this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.